Some drugs just treat a disease, but then there are others, the ones that completely change how we fight disease altogether. Today, we're going to talk about a drug that did just that. This is the story of Trastuzumab, the original cancer-fighting smart bomb that basically wrote a whole new playbook.
So, to really get why this drug was such a game changer, you first have to understand the problem it was designed to solve. Just imagine a cancer that's permanently stuck in overdrive, growing and spreading at this terrifying speed. How on earth do you even begin to stop that?
Okay, so for a long time, doctors knew about this particularly aggressive type of breast cancer. For patients, the prognosis was, well, it was really poor because the traditional treatments just couldn't keep up. The cancer was just too fast, too relentless. And then there was this incredible realization. The problem wasn't the entire cancer cell itself. Nope. It was something much smaller and way more specific. The real villain here was a single, rogue protein that was completely hijacking the cell's internal machinery. And that rogue protein? It's called HER2. You can think of it as the engine that's driving all of this out-of-control growth. And to beat the cancer, scientists knew they had to go after HER2 directly.
So, what is this HER2 thing anyway? Well, it's a receptor that sits on the surface of a cell, and it's kind of like a gas pedal. Its normal job is to get signals that tell the cell, hey, it's time to grow and divide. In a healthy cell, this whole process is perfectly controlled. But here's where it gets crazy. This is the sheer scale of the problem. A normal cell might have, say, tens of thousands of these HER2 gas pedals, but a HER2-positive cancer cell, it has millions. Just think about that. With millions of gas pedals all jammed to the floor, the cell gets this constant, overwhelming signal to just grow. It's biological hyperdrive. And this isn't some super rare thing either. We find this hyperaggressive growth engine in about 15 to 20% of all breast cancers, and in other cancers too, like some stomach cancers. That's a huge number of people facing a really tough diagnosis. Okay, so this is where our hero enters the story. Scientists developed a drug to specifically go after that faulty HER2 protein. Its name is Trastuzumab, but you probably know it by its brand name, Herceptin. And let me tell you, this was not just another chemo drug. It was something completely new. And the difference is just stark. Think about it. Traditional chemo is like a blunt instrument. It's a carpet bomb for the body, killing any fast-growing cell it finds, which includes healthy stuff like your hair and stomach lining. But Trastuzumab, that's a precision weapon. It's a guided missile designed to seek and destroy only the cells that are overflowing with HER2, leaving healthy cells pretty much alone.
So, how does this smart bomb actually work once it finds its target? Well, it's not just one thing. It's this really clever two-pronged attack that completely shuts the cancer down. First, Trastuzumab literally latches onto the HER2 protein, basically putting a cover over that stuck gas pedal. And that blocks the nonstop growth signal from ever getting inside the cell. But it gets better. Second, by attaching to the cell, the drug acts like a big, bright flag. It signals your body's own immune system to come over and destroy the cancer cell. It is just a brilliant one-two punch. And the impact of this new approach? Wow. It was nothing short of a revolution. What was once one of the most feared cancer diagnoses suddenly became manageable, even treatable. The entire outlook for patients just changed, almost overnight. So, just to run through the basics, Trastuzumab is mainly used for HER2-positive breast and stomach cancers. It's usually given either through an IV infusion or a simple shot under the skin. For folks with early-stage cancer, a typical course of treatment lasts for about a year. But of course, even though it's targeted, it's not a magic bullet. The most significant risk is potential damage to the heart muscle, something called cardiotoxicity. That's why doctors monitor heart function so carefully during treatment. People can also get flu-like reactions, especially with their first dose. And importantly, some cancers are just too clever. They can develop resistance and figure out new ways to grow even when HER2 is blocked. But even with those challenges, its legacy is undeniable. I mean, this one summary from the research says it all, really. It transformed HER2-positive breast cancer from one of the most aggressive and deadly subtypes into a highly treatable disease. That is a monumental achievement in the history of medicine. But beyond treating this one type of cancer, Trastuzumab's greatest legacy was that it was proof of concept. It was the first huge success story for targeted therapy. It proved that if we can find a cancer's specific weakness, its Achilles heel,
we can design a smart weapon to attack it. This idea opened the door to the entire field we now call precision medicine. And that really brings us right up to today. Trastuzumab was like the first shot fired in a whole new kind of war on cancer, one that's fought with intelligence and precision, not just brute force. And it leaves us with this really powerful question for the future. Now that we know this works, what's the next target?